Okay, good morning. My name is Khurshid Akhtar. I work in Salford Royal NHS Foundation Trust as a consultant general and upper gastrointestinal surgeon. I've been working there for over 10 years and I have worked in NHS for 30 years. My special interest is upper GI cancer, gastroesophageal reflux disease, and gallstone diseases. With regard to gallstones, there are three different types of gallstones: cholesterol stones, bilirubin stone, and mixed stone. The most common type of stones are mixed stone, but cholesterol stones are also present in up to 15% of patients, and they are large stones and they are not always symptomatic. So symptoms of gallstones, there are some common symptoms and some not that common. It is possible for people to have gallstones and don't have any symptoms. And it is estimated that up to 15% of patients may never get any symptoms. But majority of patients would at some time get symptoms. The most common symptom is pain. Pain is usually comes in episodes of severe upper abdominal pain, mainly localized to upper part of the tummy and radiates to the right side, and then it could also travel to the upper back. Some people could experience pain in their scapular area on the right side as well. These pains are very severe. Most of the time patients feel very uncomfortable and can't rest. Pain could last for up to several hours, and a lot of the time people feel nauseous and also can be sick. Pain usually settles after a period, either by medication or on its own. And once the pain gone, a lot of the time people, although feel exhausted, they feel otherwise all right. Other symptoms of gallstones are dyspepsia, feeling unwell, and if people get infected, then feel ill and be unwell for quite some time. Sometimes gallstone presents with jaundice, that is yellow discoloration of skin. And occasionally there could be serious complications like pancreatitis. So gallstone, if one is symptomatic and see the doctor and they suspect that you could have gallstones, then one of the most first investigations that we do is to ask for an ultrasound scan of the abdomen. Ultrasound scan is, in ultrasound scan, a machine is used to send ultrasound waves over the body, and it can identify stones if it is present. It's a very sensitive test. It is in good hand. It could diagnose stone in 98% of the cases. If there are other investigations that we would do to either assess the severity of the problem or to get more information. And these are like some blood tests to check if there is infection associated with gallstones, or we do MR scan to look to see if any stones have moved and gone into bile duct or other areas of the biliary system. Sometimes we would also do CT scan to see if there is acute infection present. So these investigations are very sensitive and usually gives us a very good idea of the presence of gallstone and also severity of the problem. So gallstone, if it is symptomatic, it should be treated because symptoms could keep coming back again and again, and there is a possibility that some potentially serious complication can occur, like severe infection in the form of cholecystitis, or patient could develop jaundice or develop pancreatitis. So if there is an indication for treatment for gallstones, which your clinician would consult with you and advise, then the best treatment is surgery. Surgery, in surgery, we remove the gallbladder along with the stones. And it is a very, very successful treatment. And in 99% of the case, people would not have any further problem related to gallstones. Regarding question about other treatment, like medical treatment to cure gallstone disease, it's a difficult one to administer. It is possible to take some medicine and reduce the size of stones. These medicines one has to take for long period, and it's gradually can dissolve stones. Sometimes it takes 2 years for stones to dissolve. The problem with these treatment is that there are side effects, but also it takes long time to dissolve, and the stone first becomes smaller and then they disappear. Potentially, these could cause its own problem because small stones can move and can block the ducts and make people ill because of it. So it is not an advisable treatment, and we only administer these medication in very selected cases where surgery is not possible and patients have got severe symptoms. So the current way of doing gallbladder surgery is laparoscopic cholecystectomy. Laparoscopic cholecystectomy means a keyhole operation where we make several small 0.5 to 1 centimeters long incisions, and we put gas into the tummy to blow it and create a space, and we can work with camera and instrument to remove the gallbladder. So it is a technically complex but a very efficient way to remove gallbladder. The operation takes around between half an hour to 1 hour, and patient usually recover quickly and can go home in majority of cases on the same day. So because it is keyhole operation, what we call minimally invasive operation, the pain is less, scar is small, and recovery is also quick. Most of the patient would be able to do day-to-day activity during the first week of the operation, and will feel pretty back to normal by second or third week of the operation. So yes, operation, if everything goes all right, mm, majority of patient would be going home the same day. A patient are walking, may have some discomfort, and we give painkillers to take. Majority of these painkillers will make people feel almost completely pain-free. But if we always recommend to continue taking painkiller as long as it's needed. Um, there is not much restriction after the operation, a keyhole operation. So we advise patients to get up and move about, and day-to-day activities, once it is possible to do within the limitation of the pain, we encourage people to do. It is advisable not to drive during the first week because the scars are right at the area where the seat belt would be. So it might be uncomfortable. So we usually give advice not to drive during the first week. But second week, if one is comfortable, should be able to drive. Day-to-day activity is no problem. And regarding back return to work again, it depends what type of work one does. So if the work involves, especially nowadays, working from home or just office work, so it would be possible to do work during the first week of operation, although we don't advise to plan any work because you may be feeling tired or there might be some discomfort. So my usual advice is that unless essential, don't plan any work during the first week of operation. Second week, again, I usually advise not to have a planned work, but if you feel all right, you should be able to do day-to-day activity and work. Usually, I would say that plan return to work after 2 weeks, but some people may feel that they are tired and a little bit exhausted. And if the work is strenuous, then it is better to leave it for 4 weeks. I hope I answered all these. I'm sure there would be other questions that people have. We provide lots of information during consultation, and there are information sheets available as well in our service to make people aware of all issues.